The really good news is I get to step off the stage, well, step off the podium, and introduce somebody first who I met only a few years ago, but has actually helped change my life and my ability to understand the globe in so many different respects. Our guest speaker is Dr. David Ugai. David is the Mercy Ship's country director in Guinea and dental specialty consultant. After earning his dental degree in 2012 at the University of Minnesota, David volunteered with Mercy Ships in Guinea and was struck by the crisis in dental care that existed there. He returned to Guinea with Mercy Ships in 2018 to participate in Mercy Ships' collaboration with Guinea's only public dental school. In 2019, when the ship left, he decided to stay in the region to help support dental care and education there. The Mercy Ship partnership with the dental school at University Gamal Abdel Nasser of Conakry, which initially involved renovating some space to allow the operation of Mercy Ship's dental program, soon evolved to incorporating students at the dental school into a program to provide them with clinical experiences. In his current role, Dr. Ugai oversees education, clinical experience, young dentists that work their way through the university's dental program. Quite interestingly, this is a product of Penn Dental Medicine's Integrative Global Oral Health Program. 4 years ago, we decided to go look for how many dental schools existed in sub-Saharan Africa. The World Health Organization, the International Association of Dental Research, the American Dental Education Association, and the American Association of Dental Research, none of them knew how many dental schools or where existed in sub-Saharan Africa. The other thing we discovered is that the people that were actually running the WHO, the Fédération Dentaire Internationale, they weren't even dentists, nonetheless educators. Through the efforts that took place, we convened our first meeting looking at the impact of global oral health on sub-Saharan Africa, held initially in Kenya. A subsequent meeting that actually brought people together and resulted in the signing of an African Dental Education Association and the creation of it took place with the help of David and team from Mercy Ships. Penn Dental Medicine is having an impact throughout the globe in trying to improve and bring dental health equity throughout the world. That's the team you joined when you decided to come to Penn. So now I will be quiet and I will let David pick up. Please, David.
Dear members of the graduating class of 2026, as you sit here today in your cap and gown, it is easy to think this is about an individual achievement. But no one reaches this stage alone. Behind each one of you is a person who invested in your life, a parent who sacrificed to support you, a mentor who challenged you, a faculty member who believed in you, your first patient who trusted you, a friend who encouraged you when you needed that encouragement to continue. For each one of you, someone invested time, experience, wisdom, opportunity, and hope into your life. Because of that investment, you are here today. 14 years ago, I was sitting in the same seat as you are right now, about to graduate dental school. Ready to begin my career, try to make my mark on the world. Except there was one little difference. I had recently signed up to volunteer with an organization called Mercy Ships that operates hospital ships in West Africa, providing free surgical care. I thought that 1 year I committed to would be my grand contribution to the world, and then I would return home. Instead, it changed the direction of my life. I arrived in Conakry, Guinea, believing I was prepared to help people. This was my first time ever leaving the United States. I stepped off the ship and I entered Conakry, Guinea, and the pure chaos that existed there. For 9 months, we set up a small, free dental clinic in town to serve the local population. People slept overnight just waiting and seeking dental care. As a young dentist, I worked as hard as I could to see as many patients as possible. I remember looking out at the line and the patients stretching down the street and sometimes even wrapping around the block. I saw patients who suffered for years without treatment, patients who felt forgotten, but something kept bothering me. I thought if I worked hard enough, I could fix things. But every week, that line of patients kept getting longer and longer and longer. Over the following years, I volunteered in Haiti, Belize, and Cameroon. But everywhere I went, I saw the same thing over and over and over. The need was overwhelming, and temporary solutions were not enough to fix this problem. Sometimes life's bring you back full circle to the place where everything started. In 2018, I had the opportunity to return back to Guinea. This time, we partnered with the local public dental school, and unfortunately in 2012, I didn't even know Guinea had a public dental school. But the building was in poor condition. The roof was leaking, the windows were broken, students had no simulation, there was no clinic for students to train and see patients. This was dental education in Guinea. So we renovated the building, we equipped it as a student dental clinic with dental chairs, equipment, instruments. But I learned something very, very important. A fully equipped dental school is just the building without the people inside it. There is a famous quote by Nelson Mandela: "Education is the most powerful weapon which you can use to change the world." Over time, I realized something deeper than this. Education changes the world only when teachers choose to invest in their students. I discovered this when the dean of the dental school in Guinea asked if a few students could help treat patients alongside our volunteers. These students had no clinical experience, they had barely ever touched a patient, and honestly, I probably should have said no. I said yes. Those first weeks were very difficult. The students didn't know how to give anesthesia, they've never done a preparation, very, very, very little experience. We started from the early beginning of every morning trying to teach them. But over several months, those students transformed. Not because of a miracle, and not because of extraordinary resources, because someone invested in them. That one decision changed my life forever. After that year, I stayed in Guinea to continue partnering with the dental school. The program started small. We only could take 10 students each year. That is the only space we had available. When there was electricity, we saw patients. When there was no electricity, we sat around and spoke and talked about dentistry, sometimes for hours, about patients, about life, and what kind of person they want to become. Nothing revolutionary, just showing up consistently, little by little, petit à petit. Today, more than 100 students have completed this program. Graduates are now specializing in Morocco to become future faculty members from their own dental schools where they came from. Others are opening clinics in underserved regions in their country, and others are training the next generation of dentists themselves. Over time, these students became my family. They are the future of dentistry in their countries. Years ago, there was no simulation lab, limited clinical training, and very few resources. Today, there is a new dental clinical training center for students, an accredited dental school, and young people from different African countries, languages, and backgrounds, all sitting beside each other in Guinea, studying dentistry together. Not because one person changed the system alone, but because people invested in students who are now becoming leaders themselves. I have one piece of advice to the graduating class of 2026. Invest in people. People become capable of changing the world when someone invests in them. We cannot change the world alone, but I can invest in Amadou. I can invest in Salamatu. I can invest in Raphael. I can invest in Suleiman and others. And together, they will transform dental education in their countries. I've already seen it begin. It is a story of each of you here. Someone invested in you for you to be here. And yet, while we celebrate today, much of the world still lacks access to basic dental care. Sierra Leone has one dentist per 1 million persons. One dentist for 1 million people. That can no longer be acceptable in this world. Look at all the resources we have today. How can we live in a world where people still cannot get access to basic dental care? There are 200 graduating students today. That is more than the countries of Guinea-Bissau, Liberia, Sierra Leone, Benin, Burkina Faso, Chad, all together, a population of over 60 million persons. This is now your profession. How can you contribute? I am tired of hearing every single day about how someone died from a dental abscess. Also, I will never forget the faces of the children I've seen where a simple dental infection has disfigured them for life. A few years ago, while we were building this brand new dental center for student training, one of the workers on site started having dental pain. He called his boss and said, "Hey, where do I go?" He misunderstood those directions and went to the wrong clinic for treatment. He took a left instead of taking a right. At that clinic, the wrong tooth was removed, and the real infection spread rapidly. A few weeks later, he died. One wrong turn, a left instead of a right. A family lost a father because someone had never properly trained that student. Someone once failed to invest in that dentist as a student. Dear graduating class of 2026, the greatest need in the world is not charity. It is investment in people, investment in students, investment in education, investment in institutions, and most importantly, investment in future leaders. When people are equipped, empowered, and trusted, they build lasting solutions. They build resilient systems, and they also become leaders. Too often, we think systems change through power and influence. History shows us something different. Systems change when people invest in human potential. A teacher investing in a student, a mentor investing in a resident, a clinician investing in a patient, a leader believing in a young person before that person believes in themselves. These investments multiply. Regardless of your path, a dentist, a specialist, an educator, a researcher, or even an entrepreneur, your greatest impact will come from who you invest in. Who became better because of you? Who did you encourage? Who did you mentor? What opportunities did you create for others? True leaders create more leaders. Do not wait until your loans are paid off. Do not wait until that clinic is built. Do not wait until retirement. You can begin today. Sometimes the greatest investments are small. A conversation, a recommendation, a word of encouragement, listening to someone who is struggling, mentoring a younger colleague. Small investments can change lives. In a few years, no one here will remember your GPA. In fact, I'm very glad Dr. Mark did not mention my GPA during dental school. If you had surveyed my graduating class, I am the last person anyone would think would be volunteering or working in Africa. Actually, when I told some of the students during graduation that I was leaving for Africa, they thought I was joking. But people rarely remember your grades, but they do remember their mentors. They remember who believed in them, and they also remember who gave them hope in their lives. That is the kind of impact that endures. So class of 2026, never underestimate the ripple effect of investing in one person. One investment can transform a person. Just like someone invested in you, one day someone else will stand where you are now because you invested in them. The world does not only need more dentists, it needs more leaders willing to invest in others. Congratulations, class of 2026. Thank you.
Look here. So, David, I would not yet. I would like to officially welcome you to become an honorary member of the class of 2026. We are so thrilled to have future collaborations growing and stemming. I do have two small tokens of thank you, graduation gifts. Family is he's new class member. Thank you very much.